Hello students, we will discuss again an important common instrument used in OT, wards, casualty, or other very essential instrument. So what this instrument is, look at this, no lock, look at this very strong instrument, very stout, strong instrument with the angulation here. So what this instrument is, it is Cheatle's forceps. Now, very essential instrument used in OT, rather to transfer. You know that in OT, scrub nurse is there, circulating nurse is there. Scrub nurse will wash with the surgeon in the OT table, whereas circulating nurse is one which from the sterile area, instruments whenever required, she will, if extra instrument is required, immediately get into from the sterile area to the OT table. So any other things, whatever required thing, whatever supportive thing required during the procedure, during the operation procedure, additional things required, she will provide. So she should be aware of everything what is happening in the sterile zone, in the OT instrument area, where are the instruments, everything, thermometers and so on, whatever things she will give. So similarly, same, when additional instrument is required, she will take this instrument from this instrument. Tip is sterile because they dip it in the methylated spirit always. Nobody touches the tip. So it is sterile. From this instrument, she will hold the instrument, additional instrument required, and take it into the OT table with the scrub nurse and drop into that. So transferring the instrument from the one area to other sterile instruments is done to this instrument, what is called as Cheatle's forceps. Again, it is useful in the casualty, minor OT, ward for suturing areas, when you do small procedures. It is anywhere, it is any technical procedures when you want to do this is very important. Whereas this instrument should be always immersed in the methylated spirit. So tip is always sterile, where you can hold the sterile instrument whenever needed for any purpose to transfer or whatever it is. So that is the use of the what is called as a Cheatle's forceps. Remember, there is no lock, very strong instrument, so you can have very good grip. So it will not instrument which you are holding will not fall. So you can have a very good grip without much problem. That is the idea of the stout Cheatle's forceps instrument. So I told of the very stout with the long grip, also called a Cheatle Hodge or Cheatle's Henley forceps, a very essential instrument. Uses are all these things. It is kept in the methylated spirit when not in use, and tips and distal beds are always kept immersed in the sterile solution, so that always it is kept, should be kept sterile. That's important. Additionally, for students' purpose, there is another entity called Cheatle's cut. That is the operation theatre procedure in the GI surgery. So when you do a bowel anastomosis, proximal bowel is, if it collapses, proximal bowel is anastomosis distal, which is dilated bowel, then there will be, won't be any apposition, proper apposition won't be there when you do end-to-end anastomosis. So to adjust the circumference, we will give a cut over the antimesenteric border of the bowel. So that is so that equal dimension will be there. That is called Cheatle's cut. Give a cut, additional cut you give over the antimesenteric border of the bowel, which is circumference-wise narrower than the other side. So that is called as Cheatle's cut. During bowel end-to-end anastomosis, it is being done. So same Cheatle's forceps, Cheatle's cut, you have to always remember. So answer the MCQ. Best disinfectant for endoscopy is formaldehyde, glutaraldehyde, hypochlorite, D-chlorhexidine. Answer the MCQ again. What this instrument is? What is this instrument used for? Is linear stapler used for linear anastomosis of bowel parts? B. Circular end-to-end anastomosis instrument. Linear stapler used for bustle apposition. Linear stapler used for cutaneous apposition. So 2 MCQs are there. Answer this MCQs tomorrow in the comment box, and tomorrow I'll give the reply and with the reasoning in the comment box. Please go through this. Please request everybody to answer this MCQ. So go through my clinical methods in surgery. Every chapter is there exactly how to examine the patient in detail, and with the video of the examination. and my surgical manual of surgery, all topics covered well, whatever required as per CBM syllabus. Operative surgery covers in 2 volume in detail description of the very small minor to major surgeries, and atlas of tissue approximation of tissue position, and my Diginor lectures covers all lectures A to Z in surgery for CBME syllabus for undergraduate and PGs for early understanding. So you can always purchase this one through JP Publishers for entire lectures. So students, I hope you have understood this instrument, Cheatle's Forceps, very well. Thank you very much.